virus. As the death toll in West Africa mount technology companies developing software, not only to help pinpoint cases, but also to help spread information and combat the prejudice that's associated with the disease. Well, first let's have a look at the scale of the problem they face. The international community has been warned it must most urgently wake up to the scale of the Ebola crisis, with the virus spreading at a speed of 5 new cases an hour in Sierra Leone, with 3,340 dead and 7,072 people affected. Experts say it could have infected around 1.5 million people by January next year. Médecins Sans Frontières say the health systems in the worst affected countries, that's Liberia, Sierra Leone and Guinea, have imploded. You can see here the number of cases, the number of deaths that they've had to deal with. Well, in a moment, we'll be going to Bali. Elie Calhoun will be joining us there, who's the principal Code Innovation, the company behind the Ebola Information app. And from central London, Dr. Precious Lunga, who is a health expert, public health expert, who's worked extensively in Africa and can set the context for us here. Precious, getting the information out, is that the number one job of this kind of technology?
It's all about communication in public health. And Martin, you rightly said that there's stigma, there's fear, and phones are just one way of getting it out.
I think we can connect to Elie Calhoun, joining us from Bali. You must be pleased then, your app is going some way to help in that communication job.
Well, it's definitely one part of a much larger effort. Of course, national health systems, international organizations, and NGOs are taking the traditional path using radio outreach, television, and print media. But we saw a need to fill because in late March, when we started to hear about the crisis and the outbreak in Guinea and Liberia, there was nothing in the mobile space. And of course, although smartphone penetration is quite low in the area, people who own smartphones are influencers and have a lot of social capital. And we thought empowering them with information in local languages would do something to spread information and accurate information about the virus and how to contain it.
I was going to ask you, Elie, in the number of people who actually own a smartphone or have got access to a network that's fast and reliable are pretty few in these areas, aren't they?
Well, we know that digital phone penetration is increasing. Now, people don't have smartphones, but they will have handheld phones. So the signal, and in many cases a 3G signal, can extend to rural areas and is getting better very, very quickly. In fact, we believe that smartphones and the mobile space is actually the chief technological platform that Africa will be having access to in the next decade. We see it as growing and growing and growing.
Let's bring in Precious Lunga once again. Is that your experience, that this is an area which shouldn't be ignored, that personal communication devices, tablets and phones are being connected, albeit maybe slower than they have in the West?
Absolutely. And I would say actually, in terms of the use, we actually, in Africa, people are using them, they're leapfrogging the technology. There are fewer landlines, so almost everyone has a smartphone, and that's their primary form of communication. That's their primary form of financial transaction, and really, to most people in Africa now, the phone is their companion. I'd like to add, though, in the sense that we should always remember that we have to use all channels of communication, be it radio, be it posters. And the phone is just one of those, and the app that's been developed is a very good idea. It's excellent. We also have to remember, though, less than 10%, and in West Africa, where the Ebola outbreak is happening, less than 5% of people have smartphones. So we want to be able to reach them. We also have to think simple messages, SMSs, text messages can actually reach people quickly and to a large number of people.
What about the messages and whether they're believed, Precious? I mean, is it the case that the messages conveyed in this way do have authority, can influence behaviour?
They can. The important thing is the source. They have to be framed in a context that's actually applicable to that local setting. That's why it's very important when developing these new technologies to work with the local government, to work with the local community, and other organizations that are working there to make sure that the message is framed in the way that people in that area can really understand.
What work did you have to do, Elie, to make sure that when you got the technology to work, that the message, the editorial, was right?
That's a great question. Well, the most important thing for us was to get this information into local languages. So what we did was take information from the CDC and the WHO website, adapt it, simplify it, and get it translated into local languages. So we had a team helping us with that. We're still open to volunteers to help us translate it into other local languages. But what we saw was that people with smartphones are influencers in their community. So although the numbers may be very, very comparatively small, they have a lot of social capital and they're listened to by others in their community. So one of the things that we did was try to find as many local languages in the affected areas to get the app translated into. And I do absolutely agree, Precious. This is a small effort in comparison to larger regional and national health system efforts to contain the virus and to get correct information about the virus out there. Well, one such example is our colleagues at UNICEF with their partners putting together a platform called mHeroes, which is a mobile health information tracking system. And that, of course, is much more effective for communicating a larger effort. But for those people who really aren't content to sit at home and be afraid and wonder what to do, this is a tool to empower yourself, to empower those in your family, those in your social networks, and even your wider community to take efforts together to contain the virus.
And Precious, is this something that's going to be built upon then, more languages, more dialects, in order that it can become more effective for more people?
I think it's an excellent idea. And also with more information, there's less fear. And when people are less fearful, they're more likely to take sort of more rational actions. They're more likely to seek help when they need it.
Precious Lunga, thank you. And Elie Calhoun joining us from Bali by Skype. Thank you very much indeed.